I'm Dorothy Shaw. I'm an obstetrician gynecologist and I'm representing the Partnership for Maternal and Newborn Child Health.
I am Baba Lampono, Mothers to Mothers program. I'm a junior trainer in Western Cape, Cape Town.
My name is Patricia Michelle. I am based at the Earth Institute at Columbia University and the director of the Strategic Application of Mobile Technology for Public Health and Development.
I'm Elizabeth Mason. I'm the director of the Department of Maternal, Newborn, Child and Adolescent Health of the World Health Organization in Geneva.
So we're here talking about Millennium Development Goals. Do you want to talk about a particular Millennium Development Goal that you're very interested in seeing reached?
Sure. I think that what we know is that Millennium Development Goal 5 is quite far behind, as is Goal 4. But I think the key message is that integrating Goal 4, 5 and 6 in terms of the health problems that face women and children in particular is essential.
Can I add on? I would like to add on and saying that 3 also I think is important as empowerment. As much as we can integrate the treatment, getting women to get the treatment, but we need to empower these women to live longer and be able to take care of their families.
Sure, and I would also advocate for the empowerment of women and girls as one of the underlying change factors across all the Millennium Development Goals. I think they're all really important. I think they all interact with each other and affect each other. But I do believe that one of the areas that we haven't made so much progress in is on MDG 3, and I think that that's having a direct impact on some of the other MDGs.
I would just like to highlight that to reach MDGs 4 and 5, we talked about integration, but we need to remember the continuum of care, the continuum from pre-pregnancy, through pregnancy, childbirth, care of the newborn and care of the older child, and also from the community through to the first level facility and through to the referral centre. If each of those areas is in place, we can actually reach the MDG 4 and 5.
We've been talking about MDGs now for 10 years, and now there's 5 years left until hopefully many of them, if not all, have to be achieved. So what do we need to keep doing or do less of to ensure that the MDGs, we do reach those goals?
Well, I think that we need to, momentum is accelerating. When MDGs were agreed in 2000, it took the first 5 years for countries really to understand what commitments they had made and how to actually go about addressing these goals. So 2000 to 2005 we would say was a startup period. 2005 to 2010, we've seen action accelerating in many countries, and we can see mortality is starting to come down. What the global strategy of the Secretary General does is to accelerate further that action, bringing together all of the different components of the action to MDGs, bringing together all of the partners so that we can really move very fast for the last 5 years and achieve the goals that have been set.
And I would just add that within MDG 8 is this notion of leveraging information and communication technology and more innovative partnerships to achieve and to accelerate the achievement of the MDGs. And so I think much more strategic thinking, use, operationalization of existing and proven technologies within the larger MDG framework is needed.
I will agree in saying that as much as we know that this is hard for us to do, but we will go there, we'll be there, and we'll make sure that this is happening in community level. This is why we need to make sure that we empower these women so that they can be able to make sure that these people do have an access to health and to have an access to treatment so that people can have HIV-free babies at the end.
And in addition, there is a terrible shortage of healthcare workers, healthcare professionals in countries where women and children are dying. And it's an absolute priority, in addition to all of the other things that we hear about, that we train adequate numbers of healthcare professionals, and that we are able to provide training and skills to healthcare workers in the community, what we call task shifting or sharing. So that can happen between healthcare professionals. So an obstetrician might train a midwife, might train a community health worker in specific skills that will help a mother or child survive. So it could be dealing with postpartum hemorrhage, for instance. It could be dealing with a baby at the time of birth, ensuring that breastfeeding happens immediately afterwards, clean birth, those kinds of things. So task shifting is training someone to do a particular skill that belonged to another professional group historically. We're breaking down those barriers because we know we have to be innovative if we're going to save lives. It's really important.